Are you looking for another way to increase your physical performance and recovery? Or you want to minimize the pain that you get for a few days after a hard workout? You may want to check out using compression garments. You may have seen these skin-tight sleeves that people may wear on different parts of their body when they're out for a run, playing a sport, or sometimes just sitting on an airplane. What are they and why do people wear them? Is this some sort of fashion trend or does it have some real benefits? Hi, it's Mike Wong from East West Physiotherapy. In this video, I'll explain to you what compression garments are and how they work. I'll also tell you about the research regarding its use to help improve your physical recovery. By the end of the video, I hope you have a better idea if this is something that you want to try for yourself. Compression garments are first used to treat medical conditions like DVT and chronic venous insufficiencies like varicose veins. Those who suffer from these conditions often stand on their feet for a long period of time. They can experience swollen and painful legs. Wearing compression stockings help to decrease these symptoms. Compression garments sounds just like what it does. They compress the body through the pressure applied to the skin, muscles, and/or bones. They can be made of different materials and the mechanical properties of these garments can differ from one another. They may have different pressure gradients which may be more suitable for certain medical conditions. Some compression sleeves have graduated compression, where the compression pressure gradient changes along the length of the sleeve. Graduated compression can reduce muscle oscillation, improve peripheral circulation, and venous return. In theory, compression garments provide external pressure to reduce the space and swelling and hematoma. It can help reduce the inflammatory response that promotes structural damage after a bout of intense exercise. Compression garments that are worn during the recovery process within 2 hours after the exercise session have been shown to help improve performance in subsequent bouts of exercise. Compression is thought to provide muscle fiber alignment to support the muscles. It can also support recovery of the membrane structures and contractile properties of the muscle. A systematic review by Hill et al. Shows that the power and strength recover at a faster rate in the compression garment group compared to the non-compression wearing control group. If you have engaged in a relatively intense bout of exercise, you may have experienced DOMS, or delayed onset muscle soreness. This type of soreness can start a few days after the physical activity, and the severity can differ from person to person. It can depend on the type of exercise you're engaging in, as well as your physical condition and training status. If you're engaging in an exercise that is new to you or more challenging, you may experience the symptoms of DOMS. While the underlying mechanism is unclear, it is thought that DOMS occur because of the inflammation, swelling, and damage to the muscle fiber and its surrounding connective tissue. The inflammation can sensitize a nerve in the area, causing pain. Wearing compression garments after exercise may help with the pain by reducing the space for swelling and inflammation from the muscle damage caused by the exercise. Whether you wear compression garments during or after exercise, it has been shown to moderately decrease the level of pain experienced in DOMS. This could be due to a combination of psychological as well as physical factors. As with any studies, there are often some limitations to how we can interpret this information gained from using compression therapy. The compression pressures often used are varied in the studies, ranging from 15 to 35 millimeters of mercury. It is possible that the participants may not have received adequate levels of pressure to the body parts to induce measurable changes. The type of compression garments used can also be different. Some may use graduated compression garments where the pressure differs from one region to another, while other garments may have constant pressure throughout the garment. The fit of the compression garments for each individual may not be optimal due to body differences, and that can influence the results of the studies. Finally, the studies looked at different populations from conditioned athletes to untrained subjects. Trained participants are likely to experience the effects from exercise differently compared to those that are untrained. Future research will be needed to account for all the variables in the use of compression sleeves to recovery. From the research gathered so far, there is evidence to show that compression garments are an effective method to help improve recovery and decrease soreness from exercises. No negative effects have been demonstrated, and compression garments are quite safe to use. Find something that will be comfortable, firm, and supportive. Ideal compression garments should fit the contours of your limb. You can have the option to wear the compression garment during and after the exercises with no longer than 2 hours after your exercise session. You can wear for at least 72 hours following exercises, and the benefit seems to be most pronounced between 12 to 48 hours. I personally wore compression to sleep and took it off the next day, but your preference and comfort level with this may be different. Hope this video is helpful for you. Show your appreciation by liking and sharing the video. consider subscribe to our channel and help keep us going. And I will see you in the next time. Bye for now.